Welcome back. Welcome back to forpay.org, a non-profit based company on healthcare related issues. This is Consumers Dr. Bengala. Well, I've been talking about voluntary versus mandate. And let's talk about when you talk about voluntary and mandate coverage. How do you take care of the folks they don't have anything? This is the question a lot of people ask. How are you going to provide the insurance in so-called consumer-driven healthcare? Yes, there is a solution, folks. I'm going to talk about it because there is a way to take care of the people who can't take care of themselves, man. There is a segment of the population. You know how much is it? 2 to 3%, folks. You mean to say we are spending $3.8 trillion? You can't take care of the 2 to 3% of the American public who can't take care of themselves? Something is not right here. Something is not right, I'm telling you. 2 to 3% of the public, they can't take care of themselves. This is where we need to focus our attention, and this is what the people need the most. They need the most attention because these are the folks needs constant care, constant supervision, constant, you name it, folks. And this is where we need to focus on. And how do you provide the services to these folks? Health Review Authority, which is formed by a public-private partnership, folks. It is a public-private partnership. Nobody has a control. It's like every sector has a public-private intermediary. There are no bureaucrats. These are public-private partnership. Works for the public. Basically, they're protecting the public, consumer. Their goal is to protect the consumer. If you apply for insurance, if they are rejected, it's reviewed by the Health Review Authority, and if they do qualify, they do give a certificate of guaranteed coverage. When they issue a certificate of guaranteed coverage, you can go to any participating insurer. Why would insurers participate in this? You know what? If you want to have a big market, so-called, if the insurance companies want have an exposure to the larger market, they have to participate. There is no choice because that gives them a larger market, and they also get more participation from the other individual and companies will participate. So once they give a certificate of guaranteed coverage by the Health Review Authority, then you can take it to the participating insurer. You can buy Blue Cross, Blue Shield, Aetna, you name it. There's a private insurance, folks. You can go to any doctor, you can go to any facility. It is yours to keep. But with it comes incentives and rewards. When they give you incentives and rewards, even the folks on the street, they should be able to use the incentives and rewards and take the opportunity of benefiting from those incentives and rewards. It can be done, folks. And because we are focusing on this 2 to 3% of the public, you get a better care for these people, not being ignored right now as we speak. Anytime you have this mid-level agencies take over the healthcare, they get ignored. They just give you a card and you get lost in the system, folks. You really need to take care of this 2 to 3% who are really need the care the most. So on a regular basis, they are being monitored. Not only they're being monitored, they are being visited, they are being watched, and the technology with AI can be handled easily, these folks, and you can lower the cost of the care by federal and state agencies. Their role is to make the payments to the insurance companies. That's the way it should be. It should be as long as the insurers provide the private care, and they need to be compensated by federal and state subsidies. Those are the people we need, so-called Obamacare. Not for, when people talk about Obamacare, people misuse it and they say, oh, my income is low, I qualify. They're misrepresenting the facts. A lot of people say, oh, my income is a lot lower, so I can qualify for the Obamacare. That's not the way it should be. It should be evaluated by an agency who really deserve the care. It's not up to the individual to decide, oh, I qualify for the. You know what it is? When you say you qualify, you're basically, this is what they take the opportunity, these political parties. This is where they want to control you. Oh, you know what? Let's get the Obamacare because I qualify. And if I don't vote next time to that party, I might lose my coverage. This is what the control factor comes in, folks. This is where the control. These political games, I'm not into it, folks. I am not really. I want individuals to get freedom. I don't like when somebody gives a covered, so-called covered California, covered this, covered that. Oh, next time if I don't vote this party, I might lose my health coverage. That's what they're trying to do, man. That's what they're trying to do. And why do you think there are so many people coming into this country? And now we have to take care of them. How are you going to provide the care for them? Have anybody thought about it? These are political gimmicks. Let's not get into it. I really don't want. I want to address the people who really need the care, health care. Yes, we need. It's our responsibility to provide the health care for people who can't afford it. It is our responsibility as Americans. We need to take care of the folks who can't take care of themselves. Guys, you can hit the like button, you can subscribe, share, make some comments. You'll be seeing me in the next episode, forpay.org. Go to the landing page, get some clips and get some, we will also provide the services. When the time comes, we are going to provide the services who need the health coverage. Thank you guys for listening. I love you. I will always love you, guys. God bless. See you next time.